I know you probably are talking so much about these anti-obesity medications. I think what you don't hear as much about is the usage of these medications in, children or adolescents over 12. So for those who you are prescribing medications, is there a conversation about the use of them long term, and how is there evidence to support, someone at age 12 starting on a medication and potentially using it forever? I mean, I can't, obviously there's no long term to show, someone who's been on it for that long. But I'm just curious because, someone who is older and thinking about being on the medications forever is one thing, but someone who's 12, 13 years old starting. So how does that conversation go, and how do you advise those patients and families?
Yeah, so the most important thing is, again, to treat obesity as a chronic medical condition and to talk with your patients about how this is a disease process. And yes, that the child is likely to have that. Unfortunately, 80% of our adolescents end up having obesity as an adult. So the biggest risk factor for adult obesity is having adolescent obesity. And the way that I would discuss this is, again, this is just like diabetes. So if you have a 12-year-old with type 2 diabetes, yes, that patient will probably be on medication for the rest of their lives. And the same thing is for the obesity as well. In addition, unfortunately, some of these medications are not very old, but it's very similar to other medications that we give for asthma and for hypertension and diabetes. We do have a track record, though, of these GLP-1 agonists have been used for 17, 18 plus years now for diabetes. And so we do have some, it's not long term, but we do have some long term information that these medications are relatively safe. And what I would also state is that with the obesity, unfortunately, there is a metabolic chaos that goes on that really affects every organ system of the body. So if you can jump on treatment early, there's going to be less risk of having medical problems associated with all of the obesity later in life.